In this video, I will talk about how monoclonal antibodies could be used to treat cancer. To start off, what are monoclonal antibodies? Antibodies are Y-shaped molecules produced by our immune system to fight off invading pathogens. They are very specific in action, meaning each antibody could only bind to one target. Researchers can design antibodies that specifically target a certain antigen, such as a receptor found on cancer cells. In the laboratory, this antibody can then be made into millions of identical copies, which are known as monoclonal antibodies, or MABs. When injected intravenously into the patients, monoclonal antibodies could exert their anti-cancer effects. There are 3 different types with different working mechanisms. First are the naked monoclonal antibodies. These are the most common types of MABs for cancer treatment, and they can work in different ways. Some exert the anti-cancer effect by inducing ADCC, which stands for antibody-dependent cellular cytotoxicity. It is an immune defense mechanism where an effector immune cell actively lyses a target cell, whose surface antigens have been bound by specific antibodies. Trastuzumab is a MAB used in HER2-positive breast cancer. HER2 is a transmembrane receptor that is often overexpressed on breast cancer cells. Trastuzumab is directed against the extracellular domain of HER2. Upon binding, it marks the cancer cell for the immune system's attack through ADCC. Natural killer cells, or NK cells, with Fc gamma receptors can bind to the Fc region of the MAB. This causes the NK cell to be activated, and its subsequent release of perforin and granzymes. These molecules collectively induce apoptosis of the cancer cell. Some naked MABs bind to target proteins and prevents the downstream signaling events which are essential for the growth and survival of tumor cells. When tumor increases in size, some area of the tumor may not be able to obtain enough nutrients, and they become hypoxic. Tumor cells respond to hypoxia by producing vascular endothelial growth factor, VEGF, to promote the formation of new blood vessels. Bevacizumab, a monoclonal antibody, binds to circulating VEGF, therefore preventing its interaction with VEGF receptors on endothelial cells. It has an anti-angiogenesis effect by preventing blood vessel growth. Tumor cells will then starve to death due to insufficient oxygen and nutrients. Bevacizumab could be used to treat breast cancer, renal cancer, as well as recurrent glioblastoma. Other naked monoclonal antibodies act as immune checkpoint inhibitors to enhance immune responses against tumors. The PD-1/PD-L1 pathway is an immune checkpoint. It maintains the immune homeostasis by preventing the immune system from attacking normal body cells. When PD-L1 binds to PD-1 on the surface of activated T cells, it will deactivate their cytotoxic activity. However, this could be exploited by tumor cells to evade our immune response. PD-L1 is overexpressed on tumor cells and immune cells infiltrating the tumor microenvironment. This inhibition of T cell activity allows the continuing growth of cancer cells. Monoclonal antibodies reverse this inhibition by binding to either PD-1 or PD-L1. This way, the anti-tumor T cell response could be reinitiated. An example is atezolizumab, which binds to PD-L1 and blocks its interaction with PD-1. It has been approved to treat bladder cancer and non-small cell lung cancer. The second type is conjugated monoclonal antibodies. Usually, a chemotherapeutic drug or a radioactive particle is attached to the antibody, which serves as a shuttle to deliver directly the treatment to cancer cells. One example is polatuzumab vedotin, used in treating non-Hodgkin lymphoma with abnormal B lymphocytes. It consists of an anti-CD79B monoclonal antibody, covalently attached to monomethyl auristatin E, MMAE, which is an antimitotic agent that blocks the polymerization of tubulin. CD79B is a component of the B-cell receptor that is expressed on the surface of over 90% of B-cell malignancies. After binding of its antibody-drug conjugate to CD79B, the complex will be internalized by endocytosis. Once inside the cell, lysosomal proteases will cleave the link between MMAE and the antibody, allowing active MMAE to be released. They will then bind to microtubules and inhibit cell division, leading to cell cycle arrest and apoptosis of the cancer cell. The last type is bispecific monoclonal antibodies. As the name suggests, they are able to bind to two different antigens simultaneously. Blinatumomab is a treatment option for relapsed or refractory B-cell precursor acute lymphoblastic leukemia. It is made by taking the antigen binding region from two different antibodies and combining them together. In this case, they are the anti-CD3 and anti-CD19 antibodies. Blinatumomab binds to CD3 on cytotoxic T cells, as well as CD19, which is expressed nearly ubiquitously in the B-cell lineage. In this way, cytotoxic T cell and the cancerous B cell are brought to close proximity, initiating a greater immune response. When bound to the MAB, T cell activation is triggered. It releases cytotoxic granules containing perforin and granzymes, resulting in perforation of membrane and lysis of the tumor cell.